Hey there, Anatomy. We're going to take a look at the respiratory system reading guide. I'm going to go relatively quickly because you can pause where you need to. I'm going to just explain the things that you should have seen on your respiratory system reading guide. So the first couple things I want to take a look at, we've got the upper respiratory tract and the lower respiratory tract. We've heard of the upper respiratory tract before when you hear about getting an upper respiratory tract infection. Okay, that's going to include things like your nose, your nasal cavity, your pharynx, so on and so forth. Okay, that's going to be your upper respiratory system. Everything else is going to be considered part of the lower respiratory system. So the functions of the respiratory system, the main idea here is that we're looking at gas exchange. Okay, oxygen is going to enter our bloodstream. Carbon dioxide is going to leave our bloodstream. Okay, because of the altering carbon dioxide levels and some chemical reactions which take place in your blood. This is also going to help us maintain our pH balance. And we're also going to actually be able to produce voice production based on air movements that move past our vocal folds as well. And we're going to talk about that as well. A couple of other functions. We have olfaction, which is a fancy way of saying that you can smell things. We're able to protect our body against foreign pathogens or microorganisms by a number of different methods, which we're going to discuss in this video. Um, Mucus production, things like that, are going to help us with protection. And lastly, we're going to be able to regulate our temperature as well. This is going to be more in animals as opposed to humans, but it's at least important for us to understand. Okay, now the first part of the passageway, the first part of the air passageway, is where we take air in. So the first thing we want to look at is the nose. Okay, it's the only externally visible part of our respiratory system, and its job is to begin to humidify air and to warm air and to purify the air that we are pulling into our bodies. Okay, we have the external nares, which are our nostrils. Okay, we also have the nasal cavity, which is just posterior to the actual nose itself, is going to be the nasal cavity. Okay, and in this area, you're going to have these thin-walled blood vessels, which will start to warm the air. Okay, as the blood passes by these thin-walled blood vessels, it's going to release some heat, and it's going to cause that air to become warm. Okay, we also have a nasal septum, which is the midline which divides your nose into two halves. Okay, this is why when you pick your nose, okay, you can't just pick it and then go up and then down through the other nostril. Okay, there's a nasal septum there that prevents that from happening. Next, we have the respiratory mucosa. This is a sticky mucus. Okay, I guess you could. It's better known as snot. Let's be real. Okay, this is going to moisten air. It's going to trap bacteria, and then this is going to travel all up and down your throat. Okay, and so what you're able to do then is you're able to trap bacteria and all kinds of sweet goodness into that mucus, and then you're able to spit it out. Okay, and I know that's disgusting, but thank goodness we have that method that we can use to get pathogens out of our body. Next, we have the conchae. These are these mucus-covered projections which are inside the nasal cavity. This is going to increase the surface area. Okay, why do we want the surface area to increase? Well, now there's more spots for air turbulence. It's going to provide more spots for warming. It's going to provide more spots for filtration, so on and so forth. We also have a hard palate and a soft palate. Go ahead and stick your finger inside your mouth right now and push up. Okay, and start like towards your teeth and then work your way back. Okay, but don't make yourself throw up because that'd be gross and get all over your keyboard. Okay, or your phone, whatever. As you're doing that, okay, the first part you can feel is your hard palate. Okay, that's a separation, the most anterior separation of the nasal and oral cavity. Okay, and that's supported by actual bone right there. Now, as you move further back, okay, you'll feel it get softer. Okay, that softer portion is known as the soft palate. That's the posterior separation of the nasal and oral cavity. Now, there are issues sometimes with that separation closing up. Okay, and that's going to cause you to have a condition known as cleft palate. which is where that palate doesn't fuse together as a fetus, and then you end up being born with this situation known as cleft palate. Now, continuing on with parts of the nose, we have our paranasal sinuses, which are openings in the skull bones. Okay, this is going to allow us to lighten the skull. Okay, we don't want the skull to be completely solid bone because it would make the skull incredibly heavy at that point. It also has more functions than just becoming making the skull lighter. It's also going to allow for resonance chambers for our speech. Okay, the reason that my voice sounds the way it does is partially based on the shaping of my paranasal sinuses. It's also going to produce mucus. Okay, so that's a little storage place and production site of mucus. Our pharynx is a common passageway for food and air, more commonly known as our throat. Okay, it's about 5 inches long, and it's broken down into 5 pieces. Okay, and we also saw the pharynx. This is our second time to see the pharynx. Okay, we also saw the pharynx mentioned in the digestive unit, which we just finished up. Okay, and so of course then we were mainly talking about food. So now we're referring to air. The internal nares are a set of openings between the nasal cavity and the pharynx. Okay, so right here would be the internal nares, and that's just going to be a little separation point between the nasal cavity and the pharynx. Okay, and so here would be the pharynx right here in this area. To break down the pharynx, you've got the nasopharynx, which naso is talking about nose. Okay, so that's going to be behind the nose. You've got the oropharynx, which oro is referring to the mouth, so directly behind the mouth is the oropharynx. And then you've also got the laryngopharynx as well, okay? These are listed from the most superior to the most inferior, and it says after passing through this, your air is going to enter your larynx, which is right here, okay? So once air comes down here, it's going to slip through this little opening here and enter the larynx and then eventually the trachea. And then, of course, food is going to enter the esophagus and then it's going to continue down into your stomach. We also have tonsils, which are a very important part of the respiratory system because these are going to trap bacteria and pathogens. Okay, all 3 types are going to trap bacteria and pathogens. Okay, we have our pharyngeal tonsils, which are also known as our adenoids. Okay, these are located high up in the nasopharynx. Okay, they're way up here, and that's our pharyngeal tonsils. Okay, that's going to be a line of defense that we have against pathogens and such. We also have the palatine tonsils, which are the ones that you can see. If you open up your mouth there, okay, you can look back and you can see your palatine tonsils. Okay, when you get your tonsils removed, that's what you're getting removed. Okay, it's your palatine tonsils which are being removed. Okay, we also have the lingual tonsils, which are at the base of the tongue. Okay, you can't really see those; they're back there. Okay, I mean you know you think about, oh, I'm gonna look in the back of my mouth. Well, those are way on back there. Okay. So yeah, that's your lingual tonsils, and it has the same function. Okay, they're going to trap bacteria. So this would be your tonsil here. Okay, this little fancy little hangy down thing is called the uvula. So you got your uvula and you've got your tonsils on either side. Now, when the tonsils can't keep up, you're going to end up with bacterial growth on these. This is where you would get tonsillitis. Okay, it's really not a horrible ordeal. Okay, just a couple of antibiotics, you'll be good. And then yeah, so let's go ahead and dive into the larynx. The larynx is your voice box. It's going to route air into route air and food into the proper channels. So we want air to go down towards the lungs, we want food to go down towards the stomach. Okay, this is going to be inferior, meaning lower down than the pharynx. Okay, and it's formed by 8 rigid cartilages and then a spoon-shaped flap of elastic cartilage called your epiglottis. Okay, now the epiglottis is this little fellow right here. Okay, and what's going to happen is when you swallow, this epiglottis is going to be forced downward so that food then goes down into your stomach. When you're not in that swallowing motion, then it's going to allow air to go down this direction. Okay, When you're swallowing, however, this epiglottis is going to swing down and it's going to block that area. Okay, cartilage flap. Okay, that's what I just explained right there. Alrighty then, let's take a look at vocal folds. In class, we're going to show you something really cool that has to do with the vocal folds. It says this is formed from folds in the larynx membrane, and these are going to actually vibrate as air is forced past them. Okay, when air is going past it, it's going to cause it to vibrate. That's what gives you your voice sound. Okay. The glottis is interesting because it's not really a structure at all. Okay. The only reason that we have a glottis is because it is formed by structures around it. Okay. It's like if you look at a hole. Okay. If you were to look at a water hose, okay, and there's the hole in the water hose. The hole isn't anything, okay? The hole is empty. The only reason that you have the hole in the water hose is because of the hose itself, which forms that hole, okay? That's what the glottis is. It's a hole formed by structures around it, okay? Let's see here. We're going to quickly take a look at the parts of the lungs, okay? We got the trachea, which is the windpipe, okay? That's the first part that air is going to go down. It's about 4 inches long, and it's going to be lined with cilia, okay? That's going to be able to propel mucus out of the lungs, okay? We've also got the primary bronchi. That's the first division, which puts air into the right and left lung. The mediastinum is the most central area of the thoracic cavity. It's going to include the heart, your great blood vessels like your aorta and things like that, bronchi, esophagus, so on and so forth, okay? As far as the lungs themselves go, this is where gas exchange actually occurs, okay? Your lungs only weigh about 2.5 pounds. They're very soft and spongy. And your left lobe of your lung is going to have your left lung has 2 lobes and your right has 3 lobes, okay? This is due to what's called heart crowding, okay? Your heart crowds the left side, and so that's going to cause your left lung to only have 2 lobes. You've got more room on the right side, so therefore that area is going to be broken down into 3 lobes, okay? As far as the parts of the lungs go, we've got the apex of the lungs, which is where the lungs come up into this point. We've got the base of the lungs, which sits on the diaphragm. And we've also got the visceral pleura, which covers the surface of the lung. Okay, now the parietal pleura is a sac on the outside with serous fluid in between. That's going to reduce friction between that and other important organs. Okay, I'm going kind of fast because I'm running out of time here. Your bronchioles are all of the little branchings. So once you go down through the trachea into the primary bronchi and secondary bronchi and tertiary bronchi, then you're going to get into your bronchioles, okay, your bronchioli. And then eventually the terminal bronchioli, and then you're going to end in your alveolar sacs, okay? So here's the trachea here. Primary bronchi is here. Secondary bronchi, tertiary bronchi, then you're going to break down into the bronchioli and then eventually your alveolar sacs, okay? This is called the carina. It's the point where the 2 primary bronchi branch off. And lastly, we have the alveoli, which are the air sacs. This is going to make up the majority of the lungs, okay? Most of your lung bulk is made up of alveolar sacs, okay? And this is where the gas exchange is occurring, okay? Let's see here. And then that's going to get us into where we're going to pick up in the notes, okay? But the alveoli, that's the tail end of where the air is going to go to. So air is going to go down through the trachea, primary bronchi, secondary bronchi, tertiary bronchi, and then it's going to fill up these alveolar sacs. That, my friends, is where the gas exchange actually occurs. So yeah, that should cover the rest of your reading guide. We'll pick up with the physiology of how this stuff actually works and what it does for our body when we get to the notes. Appreciate you.